Hello, I am Dr. Bhakti Paul, an endocrinologist specializing in treatment of type 2 diabetes. I have helped many patients come off diabetic medications, especially insulin, through implementation of simple yet effective lifestyle modifications. In this video, I want to show you my approach in treating type 2 diabetes. I recently met a delightful 50-year-old lady, we'll call her Mary. Mary has suffered from type 2 diabetes for over a decade. When she came to visit me, she was taking 125 units of long-acting insulin once a day and 48 units of short-acting insulin before supper. In spite of these high doses of insulin, she continued to struggle with her diabetes. Let me show you her glucose levels. Mary was wearing a device on her arm that continuously measured her glucose levels. As you can see in this graph, in this direction, we have time measured over a 24-hour period, and in this direction, we have Mary's glucose levels. The gray zone in the graph represent her target glucose range of 70 to 180. Here is her 24-hour average glucose for that day, and as you can see, it was high at 269 with a maximum reading of 350. Despite her aggressive insulin regimen, her glucose level was almost never in her target range. Mary is suffering not from a lack of insulin, but rather an inability to respond to insulin. We call this insulin resistance. We discussed a dietary alternative and customized a dietary plan for her. I also discontinued her insulin regimen and started her on low-dose metformin. Let's review her glucose levels. So this is the day before the visit that I showed you. This is the day of our appointment. We met in the morning and she discontinued her insulin regimen and started her diet that evening. As you can see, her glucose dropped instantly in her target range. And it stayed in the target range the next day, and the next day, and the next day. Also, her daily average dropped 150 points from the upper 200s to the lower 100s. This is something she had not experienced in years. Why was a dietary plan that she tried for 3 days more powerful than the medications she was taking for over a decade? Why was her insulin not working? To understand this, we have to understand insulin and what happens when we eat and when we fast. The primary reason that insulin is made in our body is to store the energy we derive from food for later use, a mechanism designed to ensure our survival during periods of prolonged starvation. Not all foods raise insulin equally. Carbohydrates or carbs raise insulin the most, followed by protein, and very little insulin is released when we eat fat. Our body can only store carbs and fat. The excess protein gets converted to glucose or sugar. The sugar we get either from carbs or excess protein is initially stored in the liver in the form of glycogen, but capacity is limited. Once this is full, the liver converts excess sugar into fat and stores it. When we don't eat, our insulin level drops and body starts utilizing the stored energy in a sequential manner. It burns stored sugar, glycogen, first. Once glycogen stores run out, body's initial response is to promote eating. However, if we don't eat, it starts burning fat for energy only if circulating insulin levels are low. There is a great analogy in Dr. Jason Fung's book called The Diabetes Code to better explain this. Think of glycogen stores as food in the refrigerator, where there is easy access but limited storage capacity, and think of fat stores as food in the freezer in the basement, where there is unlimited storage capacity but is hard to access. When you're fasting, you empty your refrigerator first and then start emptying your freezer, provided there is no insulin. What happens if insulin is present in this fasting state? It acts like a policeman, guarding the fat stores and making it inaccessible. When people with high insulin levels and insulin resistance empty out the refrigerator, they are not able to access their unlimited fat stores. Instead, they become hungry for more carbs and resume stocking up the refrigerator again. That's why patients that take long-acting insulin struggle with weight gain, especially around their belly, and experience frequent carb cravings. Unlike our physically active ancestors, we lead sedentary lives and are not only eating more frequently, but we are also eating a lot of processed carbs, and we're paying the price. Because this form of eating causes blood glucose to spike, which will cause insulin to spike, which will keep adding fat stores and prevent us from burning existing fat stores. Our body starts relying mainly on glucose and increases carb cravings, and the cycle continues. Over time, there is persistent elevation in insulin levels, making our bodies less responsive to it. We call this insulin resistance. This insulin resistance is a precursor to metabolic syndrome and its associated health problems. Blood sugars start rising and cause type 2 diabetes. The excess carbs are converted to triglycerides, raising triglyceride levels, which then drive good HDL levels down. Contrary to popular belief, it is the excessive carbs, not dietary fat, that raises triglycerides. High insulin also elevates blood pressure and promotes weight gain around the belly, increasing waist circumference. The good news is, if we can lower insulin levels and reverse insulin resistance, we can not only reverse type 2 diabetes, but all of these associated health problems. So how do we reverse insulin resistance? And how do we train our body to burn fat for energy? The answer to both is to lower insulin and to keep insulin levels from rising over and over again. Certainly, this will not happen if you take more medications like long-acting insulin. The answer is your diet. So what are the dietary changes that will help you reverse insulin resistance? Since eating will raise insulin, your best strategy is to fast. Intermittent fasting has been shown to effectively lower insulin levels. The next best strategy is not eating foods that raise insulin the most, which is carbs, especially processed carbs. However, it is very important that medications be adjusted for you to safely implement these effective strategies, since low blood sugars can be debilitating, even life-threatening, and even mild hypoglycemic episodes will force you to eat fast-acting carbs, thereby defeating the purpose. It is also paramount that glucose be monitored on a routine basis. I prefer the continuous glucose monitor that Mary was wearing over the traditional glucometer. It is convenient, fairly accurate, and free of painful finger pricks. The biggest advantage is it displays glucose patterns, not isolated readings, making it very useful both for the patient and the doctor. So, how did we do all this with Mary? We first adjusted her diabetic medications. We discontinued the insulin and started her on metformin. Then on Monday evening, she started a low-carb diet that we customized according to her preferences. I also asked her how long could she go without eating, and she was willing to limit eating to 2 times a day within a 6-hour window. We discussed strategies to handle hunger and what she can drink in her fasting period to alleviate it. I also reviewed symptoms she can expect during this transition time as her body gradually adapts from burning carbs to burning fat for energy, so she doesn't get alarmed and confused when she is on her own. I advised her to scan her sensor on a regular basis, especially before and after meals, and she naturally found herself checking more often since her numbers were looking so much better. Over the course of the week, I monitored her numbers remotely, something I can do with a continuous glucose monitor, and she communicated any concerns she had using our secure patient portal. Once patients experience these miraculous results, they can't help but wish they had started this earlier. Well, it's never too late. I hope that this video gave you insight into my approach for treating type 2 diabetes and gave you hope that there is a dietary solution, no matter how long you've had type 2 diabetes or how many units of insulin you're on. I look forward to working with you. helping you go beyond your prescription to achieve the best A1C of your life. Thank you so much for watching this video.